Hello, welcome to week 13 of your pregnancy. You are officially 1/3 of the way to your due date. Congratulations. Over the past week, your tiny human has grown about another half an inch. He or she is now measuring just over 2.5 inches long, or about the same size as a ripe tomato. Your baby is weighing about 2.5 ounces, or about the same as an egg. The heart rate has started to slow down a little bit. It is now ranging between 120 and 160 beats per minute. Your baby's head is still the same size as its body, but good news, your baby's face looks more human and less like an alien. This week, your baby's arms and legs are getting longer. He or she is making vocal cords, tooth buds, and bones. They're drinking the amniotic fluid and creating urine. Your baby is very, very active inside your uterus. Your placenta is now fully developed and has taken over providing all the nutrients for the baby. That's good news. That means those hormone levels are going to start tapering off, and over the next few weeks, you're going to notice that those pregnancy symptoms really start to fade away. That being said, it is still very normal for you to have nausea, vomiting, breast tenderness, fatigue. It's normal for you to have the occasional cramp, the occasional twinge, the occasional spot of blood after sex. It's normal for you to have nasal congestion. You might have noticed that you have more vaginal discharge than normal. As long as it's not green, stinky, or itchy, it's fine. You may also have noticed that you have visible veins on your breasts. Those two are normal. If this is your first baby, it is absolutely fine that you don't have a bump yet or that you are not feeling any fetal movement. It's still a little early for that. If this is not your first baby, you may very well have a little bit of a bump, and some women report fetal movement at this point. What is not okay? Bright red bleeding that's enough to saturate a pad, cramping that won't go away, severe pain of any kind that is persistent. Those are reasons that you would want to contact your OB provider. If you have a visit with your OB this week, in all likelihood, they will be able to hear the baby's heartbeat with a Doppler. If you have not already done genetic testing, they'll want to talk to you about that. If you are at increased risk to develop preeclampsia, they may recommend you start taking a low-dose baby aspirin. So what should you be doing at this point? I encourage you to eat a healthy diet that contains fruits and vegetables, whole grain breads and cereals, lean meat. Stay well hydrated. If you are thirsty, you are dehydrated. Take a prenatal vitamin. I recommend you exercise. Nothing flat on your back anymore. Have sex unless you've been told not to. And go on that vacation. Remember, you're not sick, you're pregnant. Live your life. The only things you can't do at this point, you cannot drink, smoke, or use drugs. No changing kitty litter boxes, and we prefer you not eat deli meat, unpasteurized cheeses, or raw fish. What questions do you have? Please leave them in the comment section below, and while you're there, I'd love it if you'd hit that like button. If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CeeJay. I'm at your cervix.